My name is Dr Jess Eccles. I am an Associate Professor Reader in Brain Body Medicine at Brighton and Sussex Medical School. I'm also a consultant psychiatrist at Sussex Partnership NHS Foundation Trust.
My name is Christina Kampoureli. I'm a final year PhD student at the University of Sussex, and I got involved in this project as part of my PhD work. We know that there's a link between hypermobility and anxiety. So the purpose of this study was to explore this in the brain. Previous work at BSMS had looked at brain structure and function in hypermobility, but not in people with a clinical diagnosis of anxiety. So in this study, we used functional neuroimaging to monitor brain responses to facial expressions, aiming to identify how certain brain regions contribute to elevated anxiety symptoms in individuals with joint hypermobility. Specifically, we looked at people that had anxiety or didn't have anxiety, and people with hypermobility and without hypermobility. We found that the insula, which represents bodily states in the brain, and the amygdala, a central brain region for processing threats, are key hubs in a neural network connecting hypermobility and anxiety. Specifically, in anxious individuals with joint hypermobility, these regions showed greater responses to facial expressions, providing insights into how joint hypermobility increases susceptibility to anxiety.
This study is really important because hypermobility is actually very common. It affects probably 1 in 5 people, and we know that hypermobile people are more likely to experience anxiety. So it's really important to work out why that might be. And we've got lots of theories and research suggesting that there are links between hypermobility and anxiety because of differences in the brain and also differences in the body in terms of how the involuntary nervous system is functioning. This study will be useful for the future in a number of ways. The first is in raising awareness of the relationship between hypermobility and anxiety, which is currently relatively poorly understood. The second way in which it will be important in the future is identifying the need for targeted interventions for individuals. So the idea of personalized medicine. It may be that people who are hypermobile, who are experiencing anxiety, will benefit from individualized treatments. If you want to find out more about this study, please see the link below.